So our next speaker is KARI KUNTZELMAN. KARI is from Oregon, flew in yesterday afternoon. We're so happy to have you join us today, KARI. KARI is a dental therapist and president of the American Dental Therapy Association. Let's give KARI a nice welcome.
I was just saying earlier that I was so excited I wasn't going first thing in the morning, but then I was just sitting there all day, like so nervous, and now it's my turn. Well, I just want to say how humbled it is for me to be here and just be a part of your meeting, and sometimes being all the way on the other side of the country, I don't get to hear all of the really cool things that you're all doing over here, and that's part of why the ADTA and the Minnesota Dental Therapy Association moving forward really need to unify, and that's what this presentation is about today. I'm going to try really hard not to cry or pass out because I'm very nervous. So today in this presentation, we're going to go over some welcome and introductions. We're going to talk about the ADTA's past, present, and future, what it is for us to unify and have this path forward that we're talking about. And then I'm also hoping to get some of you to join the American Dental Therapy Association. So as Sherry said, my name is KARI KUNTZELMAN. I am a member of the Chickasaw Nation. My tribe is in Oklahoma. And I attended the Alaska Dental Therapy Education Program. I graduated in 2019. I moved to Alaska I live about an hour outside of Portland in Estacada, Oregon. And I moved to Alaska for 2 years and did all that. It was amazing. And then I moved back to Oregon, and I worked at NARA Dental Clinic in Portland, Oregon for 2.5 years under Pilot Project 100. It was a very intense journey. I'm no longer working in clinic. I'm working for Northwest Portland Area Indian Health Board doing some dental health aid work, but I'm not here to talk about that. I'm going to talk about the ADTA. And this is my family on the lower picture. My daughter's 2 now, and then these are a picture of me and my class, and then a month ago, I was just in Washington for a conference, and I got to meet up with some dental therapists. And the girl in the green, her name is Jessica. She is a student at the Skagit Valley School this year. And then that's my dog in Valdez, Alaska. So the ADTA has a new mission statement, and I'm just going to read it aloud because it sounds good. The American Dental Therapy Association advocates nationally for outstanding patient-centered oral health care in underserved communities to amplify public awareness on the value of dental therapists and support high-quality educational opportunities. It took us a very long time to agree on this. But we, at the ADTA and everyone here, we are all ambassadors for dental therapy. We work with advocates all over the country, including sovereign tribal nations, but not only. For the past 16 years, the ADTA has been an all-volunteer board-driven association, and this year, as of May, we hired our very first interim executive director, and it's been amazing because we've learned the hard way that you cannot be a volunteer provider-driven association. You have to have staff. You can put in all the work every day that you want, but you have to have someone there doing the work when you're working and you're seeing your patients. And before I continue, I just want to say thank you to all of the dental therapists, and I know some of these names on here that some of you are here. And if you are, you can please stand up, and I'd like to just give you a round of applause because there was a lot of work that happened before this year, and I really want to make sure that we recognize that. So if your name is on this list, please stand up so we can give you an applause. Thank you, and we'll talk after because I haven't met you yet. So this is my first year. This year I was sitting president. Last year I was president-elect, and I learned some really cool things in this position, like this information that I'm going to talk about right now. There was a research published in 2011 that kind of told us about this experiment called the Forsyth experiment, and it verified the quality, patient acceptance, cost effectiveness, and productivity of dental therapists. But program advocates were unsuccessful in maintaining the legislative authority, and we know how that goes. So, dental therapy has been around for a while, but it's just, I feel like this part of it isn't really talked about a whole lot, and so I just kind of wanted to bring that up here today. This is a very busy slide. I'm not going to go through all of it, but this just kind of shows, from 1920 to 2021 on here. It shows all of the work, all of the big milestones that we've achieved. And we can send out this PowerPoint after, so you can read through this if you'd like. But I just like to see it all on here like this because it just shows how much work that we've done and how much we've accomplished. So some of our strategic goals for 2022 to 2024 are listed here. We're working on developing a reciprocal membership with the Minnesota Dental Therapy Association, all of you, and other state associations when they exist that will, they'll emerge in the future. And we really need to find a way to be one strong voice going forward. The unity part that I keep bringing up is very important. Instead of saying, well, this provider, that provider, we're all dental therapists, and at this point, the ADTA is kind of putting on horse blinders and just moving forward and saying that we're all here to help our patients and to increase better oral healthcare access. And so we're just kind of moving forward with that. But we're working on advancing public awareness in that aspect, providing learning opportunities for dental therapists and for the public on dental therapy. And we're building a national membership organization to end oral health disparities in underserved tribal and communities of color. And part of our new membership is that we're opening up different types of membership. So even if you're not a dental therapist, you'll be able to become a member. And our new website platform is launching in 2 weeks. We're going to be doing quarterly public awareness campaigns. The ADTA is going to amplify dental therapy voices and the voices of our communities. Since I've been in the presidential seat, I've been doing a lot of presentations and making a lot of calls about how there's a lot of conversations going on about dental therapists when dental therapists are not present. And that includes all of you here today too. And I think it would be really awesome if we could get some more Minnesota dental therapists to join the ADTA so you can be a part of this, giving presentations and speaking on behalf of dental therapists instead of it being those that are not dental therapists kind of talking about us. Dental therapists have a really big role to play in eliminating oral health care disparities. The ADTA will promote inclusion to ensure that everyone feels welcome. Many American Indian, Alaska Native, and people of color have had a lot of traumatic experiences in the dental chair. We were just talking about that this morning, and we really need to try to help those patients. And that's what's so unique and specific to our training is we really had a lot of training on how to work with patients that have had a lot of trauma. The ADTA is going to provide CE credits for professional development to ensure we continue to be inclusive and trauma-informed. Am I talking too fast, or it's okay? Okay. So here's a list of some of our recent partnerships. We have been doing a lot of work with the Coalition of Dentists for Health Equity, the National Indian Health Board, the National Partnership for Dental Therapy, and our CORA, you all, the Minnesota Dental Therapy Association, and we're currently working on a CareQuest financial sponsorship grant, and we're asking them to allow us to give sub-grants so we can then give money to other organizations that are state organizations such as the Minnesota Dental Therapy Association, and that grant application is in the works right now. I feel that most of you have probably seen this. I think Colleen was talking about this morning, but if you haven't read through it, you should. It took me a while. It's a pretty big packet, but it's really important to understand what this is saying. And the National Model Act for Licensing or Certification of Dental Therapists, it's kind of a start for states that don't yet have dental therapists working in their states, and instead of them having to do all the work is already here and it's already been done. And here's just another map that we need to work on updating, but in the orange it's showing where dental therapists are authorized to work in some or all settings, and in the blue that those states have had recent legislation authorized or expanded dental therapists working, but we know that there's a few more states that should be highlighted there. This slide here shows the top row where it says New Zealand. Those were the 10 students that went from Alaska to the New Zealand program and then returned to Alaska to work in their community. And the second row represents students like myself who graduated from the Ilisabet College, the Alaska Dental Therapy Education Program. And the last row is the number of dental therapists from 2 Minnesota dental therapy programs. We were trying to collect the data before I came, but we learned that it's kind of hard. It was a little bit difficult. We got this information from Danae the best that we could, but something that the ADTA is working on is creating another study for us all to fill out so we can know how many of us are working, how many of us are retired, how many of us decided to go and do something else, because it's important for us as dental therapists to keep track of our colleagues. So dental therapy education is something that the ADTA is actively promoting and working with other states on creating more education pathways. We know that there are more states in our country that has authorized dental therapists to practice, but there's not enough education programs, and that's something that the ADTA is really pushing. So some of the really great things about joining the ADTA is, again, the reciprocal membership that's still in the works. Opportunities to become a board member would mean that you have an opportunity to mentor dental therapy students. We're going to be having a job board, so I connected with a few people here today that we want to have one place that dental therapists can go to, which is going to be this website where they can sign up, become a member, look for jobs all over the country. And it'll be another way for networking and professional growth. And then for those that are not dental therapists, it'll be a way for you to support the workforce of dental therapists, support education expansion, and to stay up to date on dental therapy education and legislation. So next month, we're going to be having our annual meeting. The registration is open now, and if you're interested, I'd be happy to get your email, or I can give you my card so we can send you the link. It is on Eventbrite. This year, it's free. We're going to be offering 2 CE opportunities. One is by Dr. Horst, and then one from one of my colleagues with Northwest Portland. And this is where we're really going to just talk about all the great things that the ADTA is doing. Shane, I believe his last name is Rogers, he helped to put out the HRSA report that was just recently put out. He's going to be there to answer some questions. Dr. Shafstall-Cohn, who is in charge of the Alaska program, is going to be there to answer questions. Dr. Hogan with Washington, and we're in the process of trying to get someone from Minnesota, so if you know anybody, I have reached out to Dr. Self and Danae as well. And then here are our current board members. Some of their faces on there. And I think I saw a few people in this picture. I don't know where it came from, but it happened to be on here. I just want to say again, thank you, and how much it means that I was invited to come and be here, because on behalf of the ADTA, I know how important unity of all dental therapists is, and I know that there's been division in the past. And I'm just going to say right now that I'm not going to let that stand anymore, because dental therapy is really important for us as providers and for our patients.